Sometimes the cause is physical, like vaginal dryness, which can be due to hormonal changes, especially after childbirth or during perimenopause. It could also be caused by not enough arousal before penetration. That's not a failure on your part, it's an opportunity to slow down, communicate, and get in sync with your body and your partner. Lubrication isn't shameful. It's smart, and it can make a massive difference. But there are also deeper medical reasons that could be contributing, like endometriosis, pelvic inflammatory disease, or even undiagnosed infections. These are real, diagnosable, and treatable conditions. Ignoring them doesn't make them disappear, it only prolongs your suffering. And yes, emotional or psychological factors play a role too. If you have a history of trauma, anxiety, or trust issues, your body may resist intimacy, no matter how much you logically want to connect. Your mind and body are a team. When one is hurting, the other responds. Solutions aren't one size fits all, but they start with honesty. Be honest with yourself, then with your partner, and finally with a trusted health provider. If your doctor dismisses your pain, find another. Your well-being is worth fighting for. Talk therapy can help unpack emotional blocks. Pelvic floor therapy can strengthen muscles and reduce tension. Sometimes, just relearning how to be intimate, without pressure, can rebuild trust with your body. You deserve intimacy that's joyful, not painful. You deserve a relationship where your comfort matters. Pain during intercourse isn't your fault, but ignoring it is a disservice to your health, your happiness, and your future. So advocate for yourself. Be vocal. Ask questions. Get the support you need. Your body is trying to protect you. It's time you listen. Pain during intercourse is not something to overlook or excuse. It is your body sending a clear, important message that something isn't right, and pretending it's normal does nothing but deepen the problem. Too often, women are taught to endure discomfort in the name of pleasing their partner or not ruining the moment. But that mindset is both harmful and outdated. Physical pain, especially during one of the most intimate and vulnerable experiences, should never be normalized. Whether it's a sharp sensation, deep internal ache, burning, or lingering soreness, each form of pain is a signal worth investigating, not suppressing. Many people think they have to just deal with it, believing they're too sensitive, not trying hard enough, or that their experience is somehow unique and shameful. The truth is, pain during sex is surprisingly common, but common doesn't mean acceptable. It's not just a phase or something you outgrow. Ignoring it can turn what should be a positive experience into one associated with dread, anxiety, or even guilt. That emotional weight adds a new layer of distress, creating a cycle where the body tenses up, bracing for pain and causing more pain in return. When you ignore that pain, you're also unintentionally teaching your body not to trust your own signals. That inner voice that says, "This doesn't feel right," deserves to be heard. When dismissed, you begin disconnecting from your own intuition, and intimacy turns into performance rather than connection. You may start to feel defective, or fear intimacy altogether. That's not the relationship you deserve, with yourself or with anyone else. Addressing pain doesn't make you fragile or high maintenance. It makes you aware, responsible, and brave. It means you care enough about your well-being to pay attention. If you broke a bone or had recurring stomach pain, you wouldn't wait months or years before seeking help. The same standard should apply to your sexual health. Pain is never just physical. It impacts your emotional, relational, and even mental health in deep ways. Respecting your body means honoring the signals it gives and taking them seriously, without shame. You're not overreacting. You're being wise, and that's something to trust. There are a wide range of reasons why someone may experience pain during intercourse, and understanding those causes is the first step to reclaiming healthy intimacy. One of the most common physical causes is vaginal dryness. This can be due to inadequate arousal, hormonal changes during postpartum or menopause, or even as a side effect of medications like antidepressants or birth control pills. When the body isn't naturally producing enough lubrication, penetration can feel irritating or even painful. This isn't a reflection of desire or love, it's biology, and it's manageable. Another common culprit is an underlying medical condition. Endometriosis, for example, is a condition where tissue similar to the lining of the uterus grows outside of it, causing deep pelvic pain, particularly during sex. Pelvic inflammatory disease, ovarian cysts, or uterine fibroids can all create internal discomfort. Sometimes, The pain might be linked to untreated infections like yeast infections or bacterial vaginosis, which cause inflammation and sensitivity. These aren't rare, and they're not embarrassing. They're medical issues that deserve care and proper treatment. Tight or overactive pelvic floor muscles can also be a source of discomfort. When those muscles are in spasm, even gentle penetration can feel like hitting a wall. This may develop over time due to chronic stress, trauma, childbirth, or simply a lack of awareness. Many women have never even heard of pelvic floor dysfunction, yet it plays a major role in how the body responds to sexual activity. Then there's the emotional and psychological side. Past trauma, including sexual abuse or even emotionally unhealthy relationships, can condition the body to respond to intimacy with fear or resistance. Anxiety, depression, or low self-esteem can all impact arousal, muscle relaxation, and desire. If you've been taught to view sex as shameful or taboo, your body may hold on to those messages physically, making it difficult to relax and fully engage. All of these causes, physical, emotional, or medical, intersect and influence each other. The body doesn't separate mental stress from physical tension. That's why it's essential to take a full body, full mind approach when pain shows up. The cause may not be obvious at first, and it may be more than one thing at once. But the good news is that with attention and care, most causes can be addressed and healed. Finding relief from pain during intercourse begins with breaking the silence and choosing to communicate. The first step is to have a conversation with yourself, acknowledging that the pain is real, valid, and deserving of attention. From there, communicating with your partner is essential. It's not about placing blame or creating guilt, it's about building a foundation of trust and understanding. When your partner knows what you're experiencing, they can be part of the solution instead of unknowingly contributing to the problem. That may mean slowing things down, focusing on foreplay, using more verbal feedback, or simply pausing when your body needs it. Lubrication is one of the easiest and most effective tools, whether it's silicone-based, water-based, or organic. Using a quality lubricant can dramatically reduce friction and discomfort. There's no shame in reaching for it. Needing lubrication doesn't mean you're not aroused or that something's wrong. It means you're listening to your body's needs. Especially during hormonal changes like postpartum or menopause, adding moisture externally can create a huge difference in comfort and confidence. Medical evaluation is another non-negotiable. Pain shouldn't be self-diagnosed or brushed off. Seeking a gynecologist who listens and takes your concerns seriously is critical. If your current provider dismisses you or says, "It's just in your head," it's time to find someone else. You deserve to be heard. Sometimes it may require seeing a pelvic floor specialist, undergoing testing for infections or conditions like endometriosis, or adjusting medications that may be contributing to the problem. Pelvic floor physical therapy is often a game changer. These therapists specialize in treating the muscles, nerves, and connective tissue that affect sexual function. Through targeted exercises, massage, and retraining techniques, many people see significant relief and restoration of comfort. This is not alternative medicine. It's legitimate, evidence-based care that often goes unmentioned but holds immense healing potential. And let's not overlook emotional support. If past trauma, anxiety, or self-image issues are at play, working with a therapist trained in sexual health can be transformative. There's no quick fix, but over time, you can rebuild a healthy relationship with your body and with intimacy. Sometimes healing means unlearning shame, resetting expectations, and learning how to relax in your own skin. These solutions work best when approached with compassion and patience, knowing that your comfort is not a luxury. It's a necessity. Your comfort, your health, and your experience within intimacy matter deeply, more than most people have ever been taught to believe. Many individuals, especially women, have internalized the belief that sex is something to endure rather than enjoy. That if something hurts, they should stay quiet. That their role is to perform, not to participate. That mindset is damaging not only to physical well-being but to emotional identity and self-respect. Reclaiming your right to safe, pleasurable intimacy means stepping away from silence and choosing to advocate for yourself without guilt or apology. You deserve a relationship, both with yourself and with a partner, that honors your boundaries. If your body is reacting with pain, it's not betraying you. That's trying to protect you. That signal isn't a nuisance. It's wisdom. Ignoring pain doesn't make you strong, it makes healing harder. Your body's voice deserves just as much respect as your mind's. And when you speak up about discomfort or say no to something that doesn't feel right, you're not being difficult. You're setting a standard for the kind of care and respect that should be present in all intimate spaces. Advocating for yourself might look like saying, "We need to slow down," or "I'd like to try something different," or even, "I need to pause and talk to a doctor before continuing." Those are brave statements, and they come from a place of strength. You're not pushing your partner away. You're inviting them to be part of a relationship that's built on trust, openness, and true connection. And if your concerns are met with resistance or dismissal, that's not a reflection on you. It's a reflection on what the other person is or isn't willing to understand. Your comfort isn't optional. You are allowed to ask questions, seek second opinions, explore treatment options, or even step away from sexual activity altogether until your body feels safe again. The idea that intimacy must come with pain is outdated and harmful. You are not made to suffer through what should be a shared, joyful experience. You have the right to define what intimacy looks like for you, and you have every reason to expect that it includes respect, care, and physical ease. Your voice, your boundaries, and your well-being matter. Always. Pain during intercourse is not something to tolerate, dismiss, or quietly endure. It's a signal, loud and clear, that your body needs care, attention, and respect. Whether it stems from physical, emotional, or medical causes, every form of discomfort has a root, and more importantly, a path toward healing. You are not alone, and you are not broken. Speaking up, seeking help, and prioritizing your well-being are acts of strength, not shame. When you honor your body's signals and advocate for your comfort, you open the door to deeper, safer, and more fulfilling intimacy. You deserve to feel good in your own skin. Never settle for pain where there should be connection.